From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello, everyone. I'm Genaye Channel with my co-host, Dr. Philip Katz, the chairman of the Gastroenterology Division at Einstein Healthcare Network. And this is the Gastroenterology Show. Our topic is GERD. Dr. Katz, let's get right to the questions which stem from our viewers. So what exactly is GERD?
So Genaye, GERD, what we call gastroesophageal reflux disease, is a group of symptoms like heartburn or burning in the chest, regurgitation, the bringing back of fluid up into the chest from the stomach towards the mouth, that causes symptoms or injury to the esophagus. That's the real definition of GERD. Most people in the community know it as heartburn or this regurgitation or chest pain symptom.
So how is GERD typically diagnosed?
The patient first will go to the doctor because of symptoms. They'll have burning under the breastbone that comes up after a meal, or they'll feel a regurgitation of food up into the mouth or chest pain. The doctor will go through a series of questions and a differential diagnosis, and sometimes we'll make the diagnosis without any testing. An endoscopy can be performed, so a lighted scope can be passed into the mouth, down into the esophagus while you're sedated, or even unsedated, and see if there's injury to the esophagus. Or a monitor can be placed either through the nose or into the esophagus to see how much acid comes up and down throughout the day. And finally, sometimes we diagnose the disease based on a response to a medication.
Interesting. So let's just say I'm always having heartburn. I'm eating chicken wings and I get a heartburn. And instead of going to the doctor, I decide, let me handle this myself. I'm going to go to CVS or a local pharmacy, take something, and hopefully that'll clear it. What are the dangers of doing that?
So what you're talking about are using over-the-counter medications, which when used according to the label are very safe. Most of them are indicated, however, for short-term use, either for days, weeks, 2 weeks, with some cycling allowed based on the label. So what I like to tell patients is the following. If you're having these symptoms more than 1 or 2 times a week, you should probably see a doctor. If you're needing those over-the-counter medications on a regular basis, even following the label, you need them over 2, 3, or 4 months on a regular basis, then you should be going to see a doctor for at least 1 visit.
And let's talk about treatment. Let's say someone is diagnosed with GERD, and what are their treatment options?
So the very, very vast majority of patients can be treated with medications. As we already mentioned, some of the over-the-counter antacids, or drugs that we call histamine receptor blockers like ranitidine or cimetidine. The most common drug are called proton pump inhibitors. People know them as omeprazole and other proprietary names that people can find out from their doctor. A proportion of people will not respond to those medications, be worried about side effects, perhaps even have side effects, and they would be candidates for a surgical procedure or even a procedure done through an endoscope. So there are multiple options, the majority of which are done with medication.
Are there any age risk factors with GERD?
That's a very good question, and it's a hard answer. In general, the more severe GERD and the complicated GERD that we see tends to occur in older people, people over the age of 50 or 60. Sometimes the problem called erosive esophagitis, which is damage to the tube itself, occurs more commonly in men than women. Perhaps being overweight increases your risk of a complication. The symptoms tend to spread out over a large population, and it's hard to be age discriminant or race or in any way discriminant when it comes to just the symptoms. So age, weight, and maybe gender increase your risk of a complication.
Any way this can be prevented?
It's not clear whether a GERD can actually be prevented. We'd like to think that being on a perfect diet might cut down on your symptoms, But the reality is there's some very thin, extremely healthy people who have very complicated GERD.
Yes.
And there are some very unhealthy appearing people who doctors would say, oh, you must have reflux, who don't. So in reality, it's tricky, and it's really hard to say that you can completely prevent it by doing anything. But diet tends to be part of the treatment.
Well, Dr. Katz, thank you so much for this great information. Be sure to watch more episodes on this topic and other issues of interest to all patients here on the Gastroenterology Show. We will see you next time.
From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.